Good morning. I'm State Representative Tim Jones, and I bring you greetings again from our state capitol here in Jefferson City. We are heading into the home stretch of the session. Next week is our last week. I'm very happy to say that many of the priorities that the House set at the beginning of session way back in January, which seems like years ago at this point, have been accomplished. Last week we passed a budget out of the House and the Senate, and it has been sent to the governor's desk. And the budget is a constitutionally mandated, balanced budget. We successfully balanced that budget even in these tough economic times, and we did that by reducing the size and the scope of government and reducing waste and fraud and duplicative spending. We cut over $500 million out of the state's budget, and we did it all without a tax increase on you and your families. So I'm very proud of all the hard work that our senators and representatives on the budget committees did throughout this entire session. I was very happy to support them on the House floor. That is a huge success. When we started session, it seemed like a very daunting task, but we were able to accomplish it with a lot of hard work and cooperation from both sides of the aisle. Secondly, I'm very happy to report that the Senate this week did pass out a version of my Healthcare Freedom Act that I've been working on very hard with many of you from around the state this entire year. Many of the Patriot and Tea Party groups came up to the Capitol 4, 5, 6, 7 times this year, at various times during the year, to help us move those bills forward. And it was by your participation that the bills did move forward. Every time we had a huge rally planned, an event occurred, mainly on the Senate side, but the Senate was convinced with the massive show of grassroots support to move that bill forward. And this week, when the final rally was scheduled, the bill did pass successfully out of the Senate and is back over in the House. It's definitely not as strong as I had wanted and I'd hoped for. It's definitely not as strong as the bill that I did pass out of the House with a huge bipartisan majority of 109 to 46 several months ago. But it is a step towards protecting our state sovereignty and your rights and freedoms that you currently enjoy in our healthcare system. This will likely be on the ballot in the August primary elections, and it will actually be the first statewide referendum on Obamacare. And I'm pretty confident that with what I've heard from citizens around the entire state this year, that measure is going to pass easily. And Missourians are going to say, we do not want Obamacare. We want the current health care freedoms and choices we have. We don't want to be forced to do anything in making our very private and very important health care decisions. So as we enter the last week of session, I know we will be having that discussion once again on the House floor, and we'll hopefully pass that bill. There's a few other high priority items that we hope to wrap up, and I will be confident in saying that we have had a successful session. We've protected your liberties, and we've protected your pocketbooks here as we wrap up the session here in 2010. So finally, I thank you for reviewing all these reports every week, and I look forward to speaking to you one last time during session next week from your state capitol. Thank you.